There is an effective way to treat your dry eye problems, and there is, I believe, only one effective way to screen your dry eye patients. I am Dr. Richard Rashid, and I would like to show you how Lacromedics collagen implants can be used to test your patients to see if they might benefit from punctal occlusion therapy. The Lacromedics collagen implant is 0.2 and 0.3 millimeters thick and 3 millimeters long. These collagen implants are placed in the patient's canaliculus, thereby impeding the tear flow 60 to 80%. This allows the physician and particularly the patient to evaluate their dry eye symptoms. And if these patients notice an improvement, they are probably good candidates for laser punctal occlusion therapy. I've used this method in literally thousands of punctal occlusion therapeutic tests, better known in our office as the POT test. Our extensive experience with the Lacromedics collagen implants have shown it to be a safe, reliable, and cost-effective way for you to show your patients the immediate relief that can be afforded by punctal occlusion therapy. The Lacromedics collagen implant has several advantages when used in the POT test. It can be quickly and easily implanted. The POT test is performed right in your office, and the procedure is commonly accepted as a separate reimbursable test. The collagen implants do not have to be removed like the silicone plugs. They dissolve naturally in 7 to 10 days in most patients. The lacrimal plugs can be put in any or all of the canaliculi. Let me show you how quickly and easily a POT test can be performed using the Lacromedics collagen implant that we just talked about. Look up, please. This is a drop of anesthetic that will numb the eyes, but you'll have no discomfort. Thank you. Put your chin right into the cup, please, and look. Here's a pearl. I place the collagen implant styrofoam holder against the patient's right cheek, and I'm able to pick up the implant and place them in both lower canaliculi without changing my position. To implant the upper canaliculi, you merely turn the implant styrofoam holder upside down and hold it against the patient's right forehead, again without interrupting your procedure. Use forceps to pull one of the Lacromedics implants from its sterile pack. The eyelid is averted to maximally expose the punctum and lateral tension is maintained. The implant is then inserted into the punctal opening. Then grasp the end of the plug with the forceps and angle it nasally. The implant is threaded into the horizontal canaliculus. It is then forced inward until it is approximately flush with the punctal opening. The end of the plug is then pushed further into the canaliculus with the closed ends of the forceps. The top end of the implant should be tucked so that it disappears into the punctal opening. The puncta are then checked under the slit lamp microscope to ensure that the implants are not protruding. The Lacromedics product and packaging are specifically designed to facilitate the procedure, and the whole process can take less than 2 minutes per eyelid. The real benefit is the relief you can provide your patients. With the use of the Lacromedics collagen implant and the POT test, you and your patients can determine if long-term punctal occlusion therapy would be effective. Once that has been determined, laser canaliculoplasty can be done to give the patient relief from the pain, irritation, and complications that arise from keratitis sicca. Now, let our patients tell you about their former dry eye symptoms and their experiences with the POT test, laser canaliculoplasty, and the relief it gave them.
Dry, burny, itchy, puffy, swelling, and red.
My eyes have always been dry as long as I can remember.
They burn and itch all the time?
Very uncomfortable.
Sometimes my eyelids really felt like they were stuck to my eyeballs.
I thought I had strained eyes.
I used Visine and I used Liquid tears.
Wrist stands and just over-the-counter medicine.
It was only temporary relief, though.
So much discomfort that I had to do something.
Dr. Rashid examined my eyes, and he found that I had a lack of tears, or that my tears were draining too fast.
He put those plugs in the tear ducts. And
He just did one eye so that I could compare the two, and I was miserable because one eye was comfortable, and I knew the other one could be that way, but it wasn't.
Yeah, when he done that test, it really felt good. I had moisture and I had water coming out of my eyes.
And I was just amazed because immediately my eyes felt more comfortable. I had lubrication of water in my eyes. I didn't have any dryness.
and my eyes were much better.
That made a vast improvement. That's really what made me decide to go ahead and have the surgery done.
I put the ice bags on my eyes to start the numbing, and then he injected and numbed my eyelids, which isn't painful, and then he just did my surgery, and while he was doing the surgery, I didn't feel anything. I could just see the light, and I just looked where he told me to look, and it was over before I knew it.
It's very simple, and it took such a short time.
The laser was no pain at all.
I didn't feel anything at all. I picked out a spot on the ceiling and looked at it the whole time, and it worked real well.
I didn't have any restrictions. I went right back to work. Never had a bit of pain or felt uncomfortable.
I felt quite a bit better, a lot better.
Wonderful.
I feel like for the first time in years I've really been able to see the world, because I always felt like before my vision was kind of limited because I had to squint all the time.
I feel good.
I used to come in over the evenings after I get through working and I'd blink them all the time. Because they'd be itching and burning, but they don't do it no more. It feels real good.
And no pain whatsoever.
I would have that procedure done over 1,000 times to get the relief I had.
Sure.
Yes, I would.
Oh, yeah.
Yes, I would. I didn't think about it. I just wanted some relief.
Last week, I had the ultimate test of whether or not the surgery had really worked. My husband and I drove my daughter back to Morgantown, and my husband smokes. Oh, you know, he's a chain smoker, and he had the air conditioner on. Now, before I had that surgery done, that would have absolutely have drove me wild. By the time we would have gotten to Morgantown, I would have had such a terrible headache, and my eyes would have looked like a ball of fire because I would have been doing this all the way up there, and my sinuses and my nasal passages would just about be closed. I would have to be breathing out of my mouth by that time. But this time, nothing. Didn't have a bit of problem.
Thank you for your attention. I know that we have stimulated your interest in the use of the Lacromedics collagen implants, the POT test, and laser canaliculoplasty for the treatment of the dry eye syndrome. Please let Lacromedics know if they can provide you with further information. Thank you.